Nowhere can you find an individual with a stronger work ethic, a deeper devotion to people, and a more intense determination to succeed and excel than Peter DeAngelis Jr. Early in life, Pete learned the value of hard work. As a teenager and young adult, he worked many long hours at Ippolito's Seafood Company, a storefront business opened by his immigrant grandfather 85 years ago in South Philadelphia. His years working in the family business made a lasting impression, the importance of personal responsibility, teamwork, and commitment. Pete's commitment to his Catholic faith is reflected in his choice of schools. He graduated from Father Judge High School in Northeast Philadelphia in 1975 and earned his accounting degree from LaSalle University in 1979. In addition to his academic achievements, Pete also excelled in baseball. A star outfielder on both his high school and college teams, Pete was inducted into the Father Judge Baseball Hall of Honor in 2012. At LaSalle, he still holds the record for the 6th highest batting average for a season, hitting .431 in 1978. One of the thrills of his baseball career was when his LaSalle team had the opportunity to play an exhibition game against the Philadelphia Phillies during spring training in the late 1970s. Pete faced one of his heroes, all-time great Steve Carlton, and got an extra base hit. Definitely a moment he will remember forever. Pete's long and distinguished record of leadership and service in healthcare began in 1979, when he was hired as manager of cost reporting, budgeting, and financial reporting for the Germantown Hospital and Medical Center. After 5 years, he joined Coopers & Lybrand as supervisor of its healthcare services department, using his financial skills and experience to serve various healthcare clients. After a year, he co-founded the Whitman Group, providing consulting services to hospitals and other healthcare organizations in the development of geriatric programs and services. While a partner at the Whitman Group, he also served as Vice President of Geriatric Research and Training Center, an organization focused on researching care options and providing training opportunities for families and caregivers for the elderly. In 1990, Pete was hired as Chief Financial Officer for the Philadelphia Child Guidance Clinic, and in 1992 returned to Germantown Hospital as its Chief Financial Officer, where he played a major role in its acquisition by the Albert Einstein Health Network. In 1997, Pete joined the region's largest healthcare provider, the University of Pennsylvania Health System, as Senior Director of Support Services in its Office of Network Development, where he was responsible for developing and managing affiliations with other providers, payers, and management services. He was promoted to Penn's Senior Vice President and Chief Financial Officer in 1999, where he led the finance function across the system. During his 4 years as CFO, Pete implemented a complete redesign of financial services and led a major financial turnaround for the entire health system. His achievements at the University of Pennsylvania Health System caught the attention of Catholic Health East, and in June 2003, Pete was recruited as its Chief Financial Officer. As CFO of one of the largest Catholic health systems in the nation, he was responsible for directing the finance department, including corporate compliance and legal services, information technology, financial services, capital planning, and risk management and insurance. Pete's key accomplishments during his tenure as CFO included his successful redesign of financial services, as outlined in the ministry's finance vision, the implementation of Lawson Enterprise Resource Planning for financial, supply chain, and human resources functions, and credit rating upgrades despite major operational challenges and the nation's economic troubles. After 7 years of proven success, Pete was promoted in 2010 to Executive Vice President and Chief Operating Officer. In this role, he was responsible for providing mission and values-based leadership, as well as direction and support to CHE's operating divisions and regional health corporations. During this time, Pete launched Accelerating Operating Excellence, AOE, a redesign of all non-clinical services as a major component of CHE's Vision 2017. Pete also supported the deployment of the system-wide strategic repositioning, which required all RHCs to assess their situations in light of healthcare reform and create plans to best meet changing community needs. As COO, Pete assumed responsibility for the system-wide Advancing Clinical Transformation Steering Committee, supporting initiatives and efforts to clinically transform the ministry. When Catholic Health East and Trinity Health initiated talks about coming together as a single health system, Pete played an integral role in the discussion and planning phases, as well as the due diligence process. In April 2013, as CHE and Trinity Health prepared to form CHE Trinity Health, Pete was promoted as president of the CHE division. He was responsible for all strategic, operating, and mission-based activities. Under his leadership, the CHE division, now known as the East Group, achieved over $100 million in consolidation-related savings in year one of the new ministry. Pete also helped achieve credit upgrades of legacy CHE debt. He delivered on his pledge for timely, transparent communications throughout the CHE system office. Meeting regularly with colleagues to answer their questions, address their concerns, and share information throughout the challenging integration process. Pete is a leader at the national level. He has been published in national journals and presented at professional meetings and conferences across the nation. A longtime fellow of the Healthcare Financial Management Association, Pete has been an active member of the Philadelphia chapter, receiving multiple awards for outstanding service, and served as president of the local Philadelphia HFMA chapter in 2004. He served on HFMA's national board from 2009 to 2012. In 2013, Pete was elected to a 3-year term on the Catholic Health Association's board of directors. He is a longtime board member at Gwynedd Mercy University, serving as finance committee chair for the last 9 years. Despite all his accomplishments, if you asked Pete what he is most proud of, he would say his family. He married the love of his life, Patty, in 1979. Together they have 2 children, Trisha and Lisa. He is the proud grandfather of Jackson, Natalie, and Leo. In his spare time, Pete likes to hang out at the beach with his family, play a little golf, and of course, root on his beloved Phillies. Patients, residents, families, physicians, and colleagues in our communities have benefited from Pete's devoted leadership and pioneering spirit. Throughout his career, Pete's focus on disciplined execution and results have been clear in the areas of quality and patient safety, colleague engagement, financial outcomes, and patient satisfaction. His commitment to the mission and core values of Catholic healthcare is evident in all facets of his life. Pete's legendary work ethic is second to none. He earned his reputation as a trusted and respected colleague and mentor, enabling him to build strong teams and strong relationships throughout our ministry and throughout the nation. Vince Lombardi once said, "Success is based upon a spiritual quality, a power to inspire others." As evidenced by his body of work, Pete has clearly inspired others to grow, to achieve, and to succeed. We are thankful for the leadership, vision, and guidance that Pete DeAngelis has brought to our ministry over the years, and we wish him well as he continues his own personal journey.